We talk about grinding and clenching and how it's important to wear a night guard so you will destroy. These teeth will become so flat because they will be destroyed. I will show you some images about destruction of your teeth. And also when I teach the technique of brushing and flossing, the patient that we present, it has destroyed most of her teeth because of her clenching and the way she bites. This is the night guards that you can come and make it by yourself when your dentist doesn't have it ready. And I tell my patient it's an emergency that you wear a night guard. So you have to put not halfway like this one. I don't know who recommend this and why they did it. Of course, in America, everything is a business. However, this is according to Dr. Frank Bijak and some good prosthodontists. It's not good to have this small night guard. This full night guard, it's better for your mouth. But just for a couple of weeks, this is not to be, I talk to patients and say, well, it's cheaper for me, and every so often I change it. Please don't do that because you start moving your jaw, you start moving your teeth, and it's not a good idea because when the time comes, you start affecting your TMJ where you have this part where you open and close is a joint. So this is good for a few days to protect your teeth, and that's it. Another amazing thing I find out, I'm mixing everything so you don't get bored, is the flossing. So the flossing, I love this purple actually. It's $5.49, but you know what, I love it. One of my favorite patients that I have that actually he said I talk too much, he uses this like constantly. And I saw one of my nephews use it, and I am about to recommend it another one of my nephews because I will show you how easy it is to use this. This goes inside your teeth. It's very resistant. I have tried this. I mean, it's CVS, but not because it's CVS. It's probably the consistency they use, and they really break easy. This one has a lot of resistance. And if I show you now with my mouth, you're gonna say, ugh, because if I ate a fruit, something is gonna come out between my teeth. So when I get home, I will do it. Maybe I talk to the production company and see my producer will agree. I will show you with my mouth or with the typodons we have at home. Always carry, well, let me finish with this because I change topics very easy because I get all excited. If you tell me, what is this good to buy? Well, it's good to have it as an emergency. These ones also, unless your dentist tell you to use it. But if you are someone that has things between your teeth or you have some space, you have implants, you are good to use it. They have behind the instructions. Otherwise, write to me and I tell you when to use it, what to use it for, and you will be happy to know that you don't need it unless your dentist really pushed and said you need to use this. Now, from the flossing, I will tell you to use the cheaper because again, it doesn't matter if it has wax, no wax. What it matters is that you have the technique, the right technique to use it. This is more complicated when I teach to my patients. They have a hardest time, but I want you to know that when I teach my patients, I tell them, I'm not charging you for this, but in payment for that, you have to come back and show me what do you understand of this brushing and flossing. So the next appointment they come, and I just give that appointment, and it's complimentary. And maybe people say you're crazy, you're losing money. However, it's my way to give back to my patients their loyalty, to give back the passion that I have for dentistry, you know, and knowing that you're making a difference in the life of a patient like I did. I hope to have a testimonial of a couple of my patients. A patient of 70 years old, retired, constantly with cavities. Just by teaching him flossing and brushing, his life changed completely. So this one is more complicated. Now that I learned how to work with this one, it's easy, but you need to know how to scoop out. So as you can see, you have glide, you have in different presentations, and also every brand will give you different type of flossing. And these brushes, don't use it unless your dentist really push you to use it. Just like water-pic. Water-pic, people said, oh, if I have water-pic, I don't need to use Flossing, no, there's nothing that is gonna substitute the flossing. I forgot to tell you that another thing I adore for dry mouth is this and the rinse. It says here, this is interesting because it says bad breath prevention. No, what gives you bad breath is not the lack of a rinse. I don't like, well, it's a marketing thing. I don't even know this company, but they use it for marketing, many companies. You can do it again. You don't need it. You can rinse with water. However, if you don't floss and brush correctly, you are not gonna get anywhere. You also need to scrape your tongue. So I have in my house my rinse just because I do it. These are melting for dry mouth. Many people now, these kids that are allowed to smoke marijuana or any other drug, that I don't agree with that, but at least try to use something that is going to give you more saliva. Because when you talk and you have saliva, saliva washes, for the enzymes we have, washes a lot of bacteria of the mouth. If you don't brush at night when we are resting, our defense mechanism is shut down, sleeping too, and bacteria takes advantage. So this is when it's important that we floss and brush at night. So as we continue with our, toothpaste, remember any toothpaste that doesn't have a lot of whitening, that has some fluoride, but the most important again is the technique. Now, continuing with that comes different toothbrushes. One toothbrush that I see that I like to have in my pocket, in my purse, and I'm sorry the camera is gonna kill me because I couldn't grab it from the shelter, but I saw them here somewhere. Oh, there. I think they're here. Well, this is a nice case for your toothbrush, but in your purse I saw some that they were small. I forgot now where I saw them. You can have, oh, these ones. See, this is kind of cute for traveling. Usually I have one in my purse. What I don't like is a very aggressive toothpaste and the rinse. But I love the toothbrush. If they have it alone, I will take it. I will ask on the pharmacy to see if they have one that is alone and they can find it for me. Now, when you look at this also I have seen a lot of people using. And look what it says here, anti-plaque and whitening. If you don't have the right technique, and this is CVS, my favorite because it's cheaper. When you talk about whole care, they're talking about natural with fluoride. It's not such a natural because they all have some chemicals, so don't get crazy about this. But what is important is the technique. Now, when it comes to kids, I used to buy to my nephews and nieces all the time the different toothpaste that were right in the. Now I'm very close. I maybe have to buy this because Raya was a movie made by a kid that I call him my nephew, Carlos Lopez Estrada. If you haven't seen it, it's an amazing movie. It has a lot of good messages, not only for kids. And I'm gonna buy this to send it to him because he was an Oscar-nominated kid. For me, it's a kid. Of course, he's older now. But the kids like to see all this. This is like a marketing for the children. So Blue Bee, etc. I'm just gonna take the Raya for personal reasons. And whatever you see for the kids, they have very little, and they have a nice taste like a chewing gum. So it's kind of nice. This is a new electric toothbrush. Now, look at the price. It's $32 and it's up to $200, $60. You're gonna see it here. Do you really need it? Well, if you're lazy like me sometimes, it's nice because you grab the toothbrush and you use it very easily. I will show you how probably in another time, but this one I'm gonna take it. And this one, to me, is not a good one. You need to have a round head like this, and it's easy to use. It happens it's just CVS, but it doesn't matter, or we have it forever. I have a similar one, and this $100, $50. I don't want you to spend that amount of money. I will show you the technique later, talking with the producer of my show, because it's important that you see how the movement of the electrical toothbrush is easy to use when you are really lazy about doing this. So we're into the final part on the On the toothbrushes, the bad thing about the electric toothbrushes, I buy the cheapest, sometimes $20. It just happened, a company gave me Oral-B and I love it. I will show you when we do again, practice the technique. Now I